There was still a chill in the spring breeze in the end of March in Shanghai, and hustle and the bustle of the megacity had suddenly entered a pause over the Omicron spreading rapidly across the metropolis. On March the 30th, the financial hub of China reported a record 3,450 asymptomatic cases, accounting for nearly 70% of the country's total at that time. And that's when the city's lockdown began, with mass, staggered rounds of PCR testing underway for its 26 million residents. Hundreds of makeshift hospitals were put into use, and thousands of medics nationwide went to support Shanghai.
上海在今年的3到5月疫情爆发的时候
The pandemic in Shanghai from late March to May was caused by Omicron's BA.2 and BA.2.2 mutations. The rate of severe cases of the mutations was about 24 per 10,000, and the death rate of the mutations was 9 per 10,000. If we didn't stick to the dynamic zero-COVID policy, there could have been over 20,000 people dying from the virus.
Measures such as region-wide and mandatory testing upon arrival have been adopted by many cities later in the country in an attempt to guarantee the flow of people on the one hand and minimize the virus spread on the other hand. As the Omicron subvariants prevalent in China are much milder than previous strains, China shifted the focus of its response strategy from infection control to case treatment with the objective of preventing severe cases. On November the 11th, China announced 20 optimized measures, a turning point for the country's COVID-19 policies. Soon after, 10 new measures were introduced to further loosen restrictions. PCR testing requirements are scrapped for most people. Infected patients no longer must undergo centralized quarantine, and businesses are gradually following up on the eased measures. But it doesn't mean the pandemic is over.
疫情管控措施放宽之后呢
Following the eased restrictions, the country is now facing the reality that first, a large number of people will get infected. Secondly, the standard of hospitalization rate, severe case rate, and death rate need to be reconsidered. And thirdly, the healthcare system nationwide is under great pressure as medical workers are also infected.
Now, the country is sparing no effort to treat the increased number of feverish patients amid the seasonal influenza and resurgence of COVID-19 cases. To relieve the burden on hospitals, many cities have turned the former PCR testing booth into temporary fever clinics. Public venues such as stadiums and theaters are also being used as fever clinics. And a second booster shot for COVID-19 has also been launched. The government is calling on more of the vulnerable groups to get vaccinated.
The community has informed and educated us. I come here as soon as I read their notification. I'm 70 years old. I think I need a jab soon in case severe symptoms strike me down.
They even arrange vehicles to take the elderly to and from homes, which is very considerate for the individuals.
It's still too early to declare victory, and challenges remain ahead. But no matter how hard the situation is, China says it will keep putting the people and their lives above all else.